Welcome to Cuyuna Regional Medical Center's Birthing Center unit. My name is Melissa and I have been doing labor and delivery for around 10 years. I'm one of the experienced labor and delivery nurses that you will meet here at our birthing center, and I've delivered over 100 babies. Let's take a tour of our birthing center unit now. Here at Cuyuna Regional Medical Center Birthing Center, we focus on the safety of you and your baby. So in order to do that, we have a locked, secure unit that only authorized employees of CRMC are able to get through. In order for visitors and family members to get into our unit, you need to be able to push this button, which shows a camera and rings a doorbell on the other side of the unit. And in order for that to do that, then we have to be able to let you in. Not anybody can just get in. We also put a tag on your baby to secure that will lock down the unit if they get too close to the doors. So authorized staff is able to get in, and now we'll take a tour of our birthing center. Here at Cuyuna Regional Medical Center's Birthing Center, once you enter in, this is what you will find. We have 6 private, comfortable patient rooms off to the right, and off to the left will be the nursery. At the birthing center here, we provide and we promote rooming in, so therefore only if the mother is wanting us to take the baby to the nursery, that's when we do it. Otherwise, the baby stays in the room with you the entire time for your stay. We promote that. It creates great bonding experiences and allows family members to visit and be comfortable with the baby in their own room and environment, staying with the mom. Now we will tour one of our birthing center rooms. Here at Cuyuna Regional Medical Center, we promote safety and we also promote privacy. So therefore, mainly we keep the doors closed, but sometimes patients like their doors open a little bit. So for extra privacy, we have the curtain that we pull in front of the door, and we have that always pulled during delivery as well. So if we need extra staff that needs to come in during delivery, then we can have that and still maintain your privacy. Now we'll enter into the room and give you a tour of the room. Once you enter the room, we have all patients come and we do what's called a non-stress test, which means that we put on the monitor and we place you on the monitor for a good 30 minutes. You will have 2 monitors on you, one that will read the baby's heart tone and one that will also read your contractions. Therefore, we can assess what is happening with you and your baby prior to making any decisions. And we'll also be checking your blood pressure and other vital signs. Our beds are fairly comfortable. After delivery, we lay an overlay mattress on to make them more comfortable for you. We do everything in our room. You labor in your room, you deliver in your room, and then you do postpartum in your room. So the only time that you would ever have to leave your room is if you were to have a C-section, and therefore we would go downstairs. But otherwise, we try and keep you in the same room the entire stay. If you were to need to leave the unit, the labor and delivery unit, to have a C-section, our nursing staff would take you privately quickly on a cart down to our surgery center. And then once your C-section is over with, you come back here and your labor and delivery nurse will recover you. So that has condensed the time that you are away from your baby, and you're only away from your baby probably for about 20 to 30 minutes after delivery. We do stay down in the surgery center with you for about 10 to 15 minutes after a C-section so that you're able to hold and bond with your baby prior to coming back up to the birthing center. Here at Cuyuna Regional Medical Center's Birthing Center, we offer many different options for laboring women. One of our options is for you to labor in the bed as you please, especially if you have an epidural. One of the other options that we have is the birthing ball. Many women like this peanut-shaped birthing ball because they're able to straddle it more comfortably and able to sit on it and rock back and forth or side to side while they're having contractions. Another option that we promote is our jacuzzi tubs. Women love laboring in there. When you're in the water, it helps take off the intensity or take away the intensity of the contractions, and so therefore you become weightless in water, and it helps women progress in their labor. Another option that we have here is water births that are available to the women if they choose to do that. Here at the birthing center, our rooms are equipped with a vanity and the toilet and also a jacuzzi tub. All of our bathrooms here are private, and we have this lovely jacuzzi tub that you are able to labor in as much and as long as you would like. The only thing that we cannot do is deliver in the tub. We would have to get you out and deliver in the bed if you were to choose to labor in this tub. At the birthing center, we can't forget about our dads. All of your support people are important to us, just like you are and your baby is, and also your safety. So therefore, we provide a polo couch for the dad to sleep on. We have a nice rocking chair that also reclines, and we have a refrigerator down underneath here that you can provide and store some of your snacks. We also provide room service here, and you and your support person are allowed to get 3 meals a day, one for breakfast, lunch, and dinner. You just need to call the room service number, which will give you a menu when you arrive at the hospital floor. Here at the birthing center, we provide a closet for you so you can put your personal items in there that you wish to bring to the hospital. We also have cable television for the comfort of you and your support person, and we also have Wi-Fi if you guys were to desire. In order to get a hold of your nurse, you will want to push the big red call button. This is your call button that has the TV, channels, and volume on it, and also the red button is to notify your nurse if you were to need anything at all with us. Alright, it is time. You're fully complete, and it's time for us to call your obstetrician to come in for your delivery. Once you come in for your delivery, we will be pushing in our delivery cart, which has all the equipment on it that we need for a safe delivery for you and your baby. And we also provide, this will be your first baby's bed, our warmer. We bring this in, and you will have a second labor and delivery nurse come in and assist with your baby as your primary labor and delivery nurse assists with you during your delivery. Communication is a key here at our birthing center, and so therefore for your safety and the communication between you and your nurse and your physician, we provide this board. It allows us to know exactly what name you prefer to be called, and also we have the name that you've chosen for your baby, whether it's a boy or a girl, your support person, also who your nurse and provider are. And another safety feature that we have is what we call our counts. So therefore we count sponges after delivery and also sharps, so we are sure that nothing has been left behind after your labor and delivery experience. For the safety of your baby always needs to be in a bassinet if it's going to be out in the hallway. And so therefore when your nurse comes to take your baby, we will have you put the baby in the bassinet and we can take it to the nursery if you need a little rest. Please, for the safety of you and your baby, never let anybody without a CRMC badge take your baby out of the room. Here at the birthing center, we also promote breastfeeding. All of our nurses here are experienced breastfeeding moms. We also have a lactation consultant. If needed, we can call at any time for your convenience. Here at the birthing center, centrally located is our nurses' station, and therefore we have access quickly to all of our labor and delivery rooms. Now we'll go in and tour the nursery. Here at the birthing center, this is our nursery. We do promote the rooming in, but on occasion we need to bring your baby to our nursery. Mostly the reason why we bring our baby to your nursery is because the mom needs a rest or we need to do the testing on the baby. We reweigh your baby on night shift to make sure that they are not losing too much weight, and we also do different tests on the baby. One of them being the hearing screen, a PKU test to test for any metabolic issues with baby, a cardiac screen, and also a transcutaneous bili to check for jaundice on your baby. When you are discharged, you will be set up for an appointment to come back to the nursery here in the birthing center at 72 hours, so 3 days after your discharge. There we do a transcutaneous bili to make sure that the baby is not becoming jaundiced, and we also ask how things are going at home to see how mom is doing with breastfeeding, bottle feeding, if the baby is voiding and stooling. We promote the nice rocking chair for mom to sit in so that she is comfortable during that check as well. As a thank you to you for choosing Cuyuna Regional Medical Center and trusting you with your life-changing experience of having your baby, we provide you as you're going home with a Crosby baby diaper bag, Cuyuna Regional Medical Center robe, box of diapers, baby blankets, a halo sack, a diaper bag, and also a box of books so that you can start reading to your baby right away and promoting that bonding experience. We would like to thank you for considering us to be part of welcoming your newest family member into this world.